for those of you who are not visitors to my channel regularly, which means basically if you're not one of my students, I'm Professor McDarby. I teach biology. By training, I'm a parasite biologist, and by training, I also focus on the evolution of things that invade hosts and cause nasty effects. And this is one of them. This is my coronavirus update for January of 2022. We're about halfway into January right now. We're in the middle of a current surge, which is the result of a lot of different things. It is Delta followed by Omicron, both of which are much more transmissible, can jump from person to person, can get into somebody, generate enough numbers to get to the next person quicker, and then seems to be better at getting into the next person and setting up shop and doing it all over again. In December, first week of December, Omicron was about 8% of the new cases in the United States. As of the last report at the beginning of January, it's 95%. So it is so much better at moving from person to person that it has done it to the point where it's pushed all the other ones aside, even Delta, which was pretty transmissible. What you're also seeing that's connected to the current surge is still a sizable fraction of people that are unvaccinated. So they're cranking out way more viruses than people that are vaccinated, even the ones that are getting breakthrough infections. And also, our attitudes have just changed. Is that, you know, we're Americans. We have no patience for anything, but we definitely don't have much patience for inconvenience. And we're kind of fed up with the inconvenience of a pandemic. So the vaccinated people are feeling protected. The unvaccinated people have not been really following a lot of the precautions anyway. It gets frustrating because the precautions don't always turn out to work. Here's the problem. You get an outbreak. It's a coronavirus. We kind of know how coronaviruses work, but we don't know how this one works. So, and it's a pandemic, so they post what are just generalized precautions. Well, wash all the surfaces. Takes a while to find out. This doesn't really pass particularly well on surfaces. So that's something that would be a good preventative for the flu, not a good preventative for this. And so they go, well, I guess you don't need to do that anymore. And people go, well, make up your mind. Other coronaviruses tend to pass in fairly large particles that come out of our breathing systems. This particular virus can spread on very, very tiny particles that can stay suspended in the air for long periods of time. So the social distancing made a lot of sense for big particles, and it doesn't hurt, but it doesn't make as much sense for what they call aerosols, things that just spread and hang for a while. The masks. Nobody had really studied the wide-scale effects of wearing masks in terms of preventing disease. We know it works in hospitals, so it was a good precaution to take. It still is a reasonable precaution to take, is that the air coming out of your system hits a barrier, slows it down, tends to catch a lot of particles, especially as it gets wet, as you breathe into it, it gets sticky. Yes, it doesn't prevent all the spread, especially if you don't cover your nose, because that's where most of the spread is going into and out of, is through your nose. And it's not, it's not one of those, well, it's better than nothing. It is relatively effective, but it isn't as effective as a lot of other things that you could be doing. And there's certain masks that are better than other masks, no questions about that. You'll also hear people go, well, you know, why do I need to get vaccinated? The vaccinated people are winding up in the hospitals anyway. Here's the thing about numbers. If 70% of the people around you are vaccinated, then roughly 70% of the traffic accidents are happening to vaccinated people. Roughly 70% of the trips on the ice are happening to vaccinated people. Now, it turns out roughly 70% of the hospitalizations are not happening to vaccinated people. Roughly 80% of the hospitalizations are happening to unvaccinated people. So that's where you do see the numbers skew, is it's that particular comparison of unvaccinated to vaccinated. It also turns out that 70% of the breakthrough infections, the people that have been vaccinated that then wind up in the hospital, well, a breakthrough infection is any kind of infection when you've been vaccinated, but the ones of those who wind up in the hospital, almost 3 out of 4 of those are my age and older, 65 and older. And most of them have other health issues, the comorbidities that people talk about. And for a lot of them, having COVID is making their other conditions worse. And a lot of times those are the reasons they're going into the hospital. They're not even necessarily going into the hospital because they've got particularly serious COVID infections. The other weird thing that's happening right now, from the latest data that I've seen, is that of the unvaccinated people that are going into the hospital, very few of them are 17 and under. But from 17 up, if you break the age range up to like 90 into thirds, that's about what you're seeing in hospitalizations. About a third of the people going into the hospital are relatively young, about a third of them are middle-aged, and about a third of them are older, for reasons nobody quite understands. Since biology, I'm going to talk about viruses. This little sucker is a casing that it steals from the original cells that it infects. So it's got a kind of a membrane-like casing. But there are big proteins sticking through that, and there's other proteins that stick through that. These are the famous spike proteins that are in the vaccines. A vaccine will put these on your cells, but it won't put these inside your cells. It won't give you an infection with COVID viruses. The spike proteins will stick to a molecule that sticks out of a lot of your cells, but particularly cells in your breathing system. And that allows stuff happens, and that allows it to kind of break open an entry point and put the payload, the RNA that's inside these viruses, inside your cells. Now, Omicron, in particular, interacts very well with the upper airway surface cells. Not quite so well with the lower airways and the lung cells. So it is a happier virus. It's a more effective virus high up in the system, which does a couple of things that make it different from the other variants. If you're vaccinated, the shot in the arm generates a type of antibody that is very effective down low, not quite as effective up high. There's not as many of them in on the linings, and the actual immune response is a little bit different. So Omicron is basically taking advantage of that. It's setting up shop high up, it's getting into the cells, it's making lots and lots of viruses and getting them out quickly, and all indications are if you're vaccinated, you are getting that under control pretty fast. As the symptoms are fading quickly, when you're contagious, and people that have breakthrough infections with Omicron do appear to be contagious, but they're not contagious for anywhere near as long as people with the other variants or unvaccinated people that have Omicron. And Omicron is having a much bigger problem with vaccinated people getting deep in and doing more serious damage. Up here, not that big a deal. Down here, big deal. And since you have interacting molecules on cells all over your body, in those occasional situations where these viruses get out of your lungs and into your general circulation, which does happen in people, that's causing a lot of bizarre kind of side effects in other parts of your body, and may be associated with what's called long COVID. is it long-term side effects that don't want to go away. And COVID does that. Some of it's pretty benign. If you had COVID and you lost your sense of smell, you got about a 10% chance of not getting it back, at least not over the period of time that COVID's been around. There's about 10% of people haven't gotten it back. And about 50% of the people haven't completely gotten it back over that period of time. Maybe eventually you will, but there's also a chance that if you don't get vaccinated and you get COVID and it makes your sense of smell go away, it might not come back. And there's other issues with long COVID. For those of you who, stepped wrong on a rock and twisted your ankle and you're still feeling that years and years and years later, you know how annoying it can be. It's not life-threatening, but for long COVID, there's a lot of side effects that people have that just last and last and last and last. And nobody knows entirely why. Nobody knows if they're gonna go away, but the odds of you getting long COVID much, much higher if you let yourself get infected. So if you're not vaccinated, if you're not careful, your odds of long COVID are significantly raised. So back to the virus. These things interact with the molecule on your cells. In goes the package inside. This is RNA. In our cells, RNA is our middleman processor. Most of what happens in your cells is done by proteins, enzymes, all sorts of things. Now for us, the code, the master code for those proteins is in your nucleus. It's in a different chamber, special processing and all that. But the proteins aren't made in there. The proteins are made outside of your nucleus, and a molecule of RNA takes the master code and brings it out where you can make proteins out of it. So a long string of RNA feeds to a little structure you have, and a long string of what's eventually going to be a protein when it wraps up in a particular way. Comes out of that same structure. These guys do that. The RNA gets into that structure that makes proteins, feeds through. One of the first proteins that comes out does a very unusual thing. I've not seen this happen in other things. Virus is not my field, so it may be more common than I realize. But this early protein, the rest of the proteins come out as a long string. And the early protein kind of watches it come out. And when you get the end of one sequence that's going to be a protein and the beginning of the next protein, it just goes snip, okay, go do what you need to do. And then it watches the next one and snip. So it's a very efficient process where with us, we make all of our proteins with individual pieces of RNA. But the most of what happens with the coronavirus is snip, 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 snip. And now you have proteins that can make more of these, that can pull a bubble of your own cell membrane together in order to package new viruses. You have enzymes that will make copies of the RNA. That's the basic code that everything is made out of. And this happens very quickly, and it happens in very, very large numbers. And away it goes. And now you've got viruses popping out of those cells and getting expelled back out into the air. In terms of viruses in general, because they get into your cell and they use bits and pieces that you would ordinarily be using yourself, it makes it very difficult to come up with good treatments for this, because anything, most of the time if you're treating for some sort of invader, you try to target something that the invader does that you don't do. Because if you target something the invader does that you do, it's going to affect you too. That's why cancer treatments tend to be so nasty, because cancer cells are your own cells doing exaggerated versions of things you normally do. And then you're targeting that most of the time in order to go after the cancer. In the case of the virus, the Pfizer pill that is pretty effective at keeping people out of the hospital targets that snipping protein, which is not something that you have, and so it gives it a target. But for a lot of viruses, there is no such easy target, which is why when you go to the doctor with a virus, they go, we can't really do anything for you. We were lucky that there were things this was doing that were targetable. While I'm on the subject, um, the Moderna and Pfizer vaccines are a package of RNA, but it's only RNA for these proteins. There's nothing else there. There's no viruses, there's no other bits and pieces, there's no DNA. And basically, it gets introduced into your cells. It has them make these and then pop them onto their surfaces where your immune system goes, oh, wow, they don't belong here. Let's make antibodies to them. And basically what an antibody is it's a mirror molecule made to antigens, foreign molecules that your immune system picks off. And then when you're exposed to those foreign molecules, like you've been vaccinated, you get exposed to COVID viruses, the antibodies hook onto these on the virus. And once they're hooked on, a signal goes out, goes, hey, immune system cells, you see this thing I'm attached to? Come deal with it. And your immune system has a whole bunch of different ways. It can poison it, it can gobble it up, it can do a bunch of things to it, but it can keep the viruses from really, really taking up shop in you. The thing about Omicron is it isn't that good in your nasal passages. Omicron is very fast and it's hard to get it under control before it's had a chance to get back out, but that's basically how it works. That's the thing about invaders, is that your typical new disease came from somewhere. It's new to people. It's not new to something else. So typically it's a disease that where something, a virus, a bacterium, other sorts of things are in other animals. They've been in there for a while. They've gotten pretty good at working inside the animals. They're kind of compatible with the chemistry of those animals. But you'll get a variant that is also compatible, sort of, with humans. It gets into us. Typically, it's not all that compatible. It messes up our chemistry. It gives you symptoms. It sometimes gives you very nasty symptoms. It sometimes produces death. And then a lot of times it jumps into people, it makes them sick, but it isn't a variant that it isn't efficient at getting from one person to the next person. A lot of flus are flus that develop in farmers, because there are flu variants that can jump from the farm animals into the farmer, but the variant is incapable of reproducing in the farmer in a way that gets it to the next farmer or to the next villager or whatever. Coronavirus, this one, probably originated in some type of bat. It's unusual. It got into people and didn't really mess with their chemistry particularly. It's rare to have much in the way of serious symptoms with this particular disease. And so its evolutionary plot follows a different course. Typically, a new disease, the variants that are going to be successful are the ones that can keep their hosts up and moving amongst other potential hosts for a while. So the variants that make you really sick, put you down, the variants that kill you quickly, put you down, they don't tend to spread very well, The ones that can at least keep you up and moving around, even if they make you fairly sick, they're going to be more successful. And the ones that make you less sick are going to be even more successful. So classically, a disease gets milder over time, but this started mild right at the beginning. That's why it doesn't follow a classic process. What makes a successful coronavirus here is its ability to get into a host, make a lot of viruses quickly, get those off to the next host. And that's what you saw in Delta, that's what you're seeing in Omicron. The next possible step is, as more and more people are vaccinated, is a variant where these molecules are just enough of a different shape that our antibodies don't fit onto them or don't fit onto them well. And so the vaccination response is not going to be as effective. How does this happen? These things are making many copies. And they're complicated copies, and they screw up a lot of the copies. A mutation is a change in the code. So you know the code the virus had when it came in, you're making more copies, you don't always get it right. Mutations work three basic ways. They're all codes for proteins, right? So you change the code, and what does it do to the protein that you're making? Protein was supposed to do something. Is it still doing it? Most mutations, the protein's still doing what it's supposed to do. You may have changed something, but you haven't changed anything big enough that you've affected the function of the protein you're coding for. The next more common result is you do affect what the protein does, but you mess it up. You're much more likely to take something that functions well, and if you just kind of randomly pop it on it, to make it not function well or not function at all. So most mutations that produce an effect produce a bad effect. Can you make the protein work better? Yes. What are the odds? The odds are horrible. It takes, I mean, they're astronomically small odds. But when you've got a lot of sick people cranking out god-awful high numbers of viruses, then you will occasionally produce a variant that is better than the original was. It's better at spreading, it's better at invading, it's better at resisting a vaccination effect. Fortunately, we haven't really seen the third one yet, but the more people cranking out, the more viruses, the odds start to favor the virus of that happening. Where is this? Where are all these viruses being cranked from? Mostly the unvaccinated. The unvaccinated have more cells that are being invaded, they're sick longer, they're spreading longer, a lot of them are not taking much in the way of precautions, and so they are our reservoir for what are called escape mutants. There's a cool term, sounds like something from a science fiction movie, doesn't it? An escape mutant is particularly a mutant that your antibodies won't attach to anymore, but it still works as an invader. And that's what we're hoping we don't see. I'm looking at my list to see if I've forgotten anything. Right now, I think we're kind of in the middle of a pretty decent outbreak. As I said, Omicron doesn't seem to be as nasty. It's not putting a proportionate number of people in the hospital as the other variants. Nobody's really sure where Omicron came from. Back to the escape mutant thing. Omicron is very, very different if you look at the codes to the other variants that were out there. For a long time, it's like, where the heck did this thing come from? And they're still not sure. It seems to be more related to Alpha, way the heck back down the alphabet, than to the more recent ones. And what they think happened is it cooked up in an isolated population of people somewhere in the world. There's a lot of people that virus can be brought in, but they don't have a lot of access to any kind of medical system or testing or any of that stuff. So it gives variants a chance to really cook and cook and cook in there. And then if one happens to get carried out to the wide, wide world, then ta-da, Omicron, or whatever the next one is gonna be. I don't know if it's gonna be pi. I think this is gonna be a pie nobody really wants. But that's how this works. And the more of us that are not harboring lots and lots of viruses, the lower the odds that one of these things in a very nasty version is going to be popping out into the world. Thank you for your attention.